Anterior approach isn't right for every patient. In patients who are obese, very muscular, very stiff, or just certain findings that we can only know on an x-ray, the femur is actually harder to visualize and to get into position that we need it to be. And if you can't quite get it into the right position, there's a higher chance of a fracture occurring during the case, which then affects the patient's rehab and weight-bearing status for about 6 weeks after the surgery. So what I would recommend more than approach would be finding a surgeon that you trust. And here at Stevens Point Orthopedics, we have multiple surgeons with lots of experience in total hip replacement. So if you're having pain in your hip, I would pick up the phone and schedule an appointment. We'd be happy to see you and look at what your options are.